Alright guys, Dr. McDermott here again. Today we have Miss Raven, who is a 10-year, going 11-year-old female cat that has a history of really kind of gross, snotty discharge from the nose. Mom says that it actually is so bad that it gets shot all over everything all over the house. She actually has to use a flashlight at night, so when she goes down to the kitchen to make sure she doesn't slip in it. So pretty gross stuff. So Miss Raven's had a respiratory infection, viral infection when she was really young, and she's kind of had it on and off since then. So today what we're going to do is we're going to try to flush this nose out. First we're going to do a culture, which is going to be sent to the lab. So it's this little swab that goes in there. They're going to grow it up on an agar plate, and they're going to tell us what type of bacteria might be in there and what antibiotics it's sensitive to. And then we're going to flush it out really well. Hopefully we'll get to show you something. We'll get some big thing of mucus out, but sometimes these things are very anticlimactic, so we just have to see how it goes. First, when we put this baby under anesthesia, we used a tube, just like we do on every other anesthesia procedure. You can kind of see here, this is what's inside there. The reason why I'm showing you is because what we also have to do is inflate this thing so you can see how it blows up like a balloon at the end. That's going down into the windpipe to make sure that we don't shoot any fluid down in there. We're also going to put some gauze in the back of the mouth, and hopefully that'll catch it. So, let's see here. So, it sounds funny, but when you do this, the best thing you can do is count how many pieces of gauze you put down there to make sure that you come out with the same amount of gauze. So we got one. We're just going to do two for right now. We may have to use some hemostats to get those out of there. And you can actually see here, if you look, the pretty nasty stuff coming out of the nose. Got some crusting on there, so let's see what we can get out. Okay. First thing we're going to do is we're going to do a culture. So like I said, it's just a swab. It's sterile. It comes in a little package, and we're going to put that in there. So here's the swab. It's going to go up there. The goal is to not go too far, but go far enough to where we get some samples in there. So about right there. Kind of moving around a little bit. And we got some good stuff on there, you can see. So then we're going to put that into the tube and send that off to the lab. Now the next step is the actual flush. So one of the things that we're going to do is we're going to measure to make sure that we don't push this catheter past the nose into the brain. So it's as bad as it sounds. So basically, good measurement, we can measure up to where the eye is pretty much and make a little mark on here with our Sharpie. And we know that we don't want to go any further than that, or else we're in brain territory, which we want to avoid. All right, so I'd like to say it's a complicated process. It's really fancy, but pretty much what we're doing is just connecting this thing and flushing it through there. So we're gonna get this thing positioned first. Let's see here, get in there. Oh, there's a lot of gross stuff in there. So there's our mark. We're not gonna go past that. And let's see here, what we're gonna do is we're gonna cut our tube a little bit to try to make sure we can fit our end on there. There we go. All right, so what we're flushing, you can see it came out there, but just saline, we're gonna flush through here, and you can see how it's already starting to bleed. This tissue in there is very, very irritated. So we're gonna go in there and we're just gonna flush and flush. And if you can't see me, but I am wearing a gown right now, so that I don't get covered in this stuff, but you can see the massive amount of just slime and mucus that's coming out of there. Use one of our gauze here. So this is what's being shot all over the house. All right, we're gonna get syringe number 2. All right, so we're gonna go on the other side. Same kind of thing, nothing fancy. There's syringe on. Oh, almost knocked my camera over there. We're back in place now. And we're just gonna flush. So you can see it's getting all this mucus and gross stuff out of there. Pretty nasty.
Jeff just did it? Yeah.
Ooh, that's some good stuff. Another one. Kind of go back and forth so we feel like we're getting mostly saline out. All right, we're making some progress. So a big thing we worry about when we do these is just making sure that we don't aspirate anything so it doesn't go into the lungs. That's why we've got our tube nice and inflated, and that we don't get too much in the back of the throat. That's why we've got our gauze in there. Let's see if we got anything interesting. We're going to need a pair of hemostats. Pull those out and check back there. So we're making some definite progress, and you know, I've done this on some patients, and we've gotten some pretty good relief from them. And it's not likely for this cat. This is not going to be a permanent solution. It's probably temporary, that we may have to redo every so often. We're also going to start on some antibiotics, and hopefully that will make us feel better. So one last little flush here. Where's our mark? Right there. Getting some good blood out of there now. That one's pretty clear. One last little thing of mucus there. Get that guy. All right. So we're not going to get everything, but we're trying to get as much as possible and just try to flush that stuff out of there. And last little step here. We're going to pull out our gauze. There's one. And number two is way in the back. We're starting to get a little bit light on our anesthesia. So we're pulling number two out. And there is what we were trying to do right there. So that is a huge mucus plug that came out. You can just see this stuff just coming out. Grab it with some gauze. But that came out of the back of the throat. It's pretty gross. I think that's going to make us feel a lot better.
If you start whining, you have to go away.
Alright, so getting that out of there. Alright, so making some progress here. So that's how we're going to do a nasal flush. Sometimes veterinary medicine is fun. Sometimes it's always fun, but sometimes it's pretty straightforward. Sometimes it's pretty gross, and some of the gross stuff can be pretty cool. I hope you enjoyed the video. If you follow us on Facebook, Dr. Travis McDermott, Vegas Vet. We also have a YouTube channel on the same name that you can subscribe and follow. You guys have a great day.